Welcome back to the News 12 Connecticut Education Notebook. I'm Amelie Wilson. Today we're learning a little more about plastic surgery. It's often perceived for the vain, but sometimes it's the only option for a lot of people who've lost a whole lot of weight. They can't get rid of that excess skin, or a nose job that it can actually help people breathe better. Dr. Rick Rosen is helping us learn more about the myths behind plastic surgery. Rick, thanks again for joining us.
Thanks again for having me.
Lots of people have breathing problems, especially with their noses, a deviated septum. They might have gotten hit in the face as a child. Tell us a little bit about those procedures and nose jobs.
Basically, it's a really straightforward, commonly performed procedure. It can be done by the plastic surgeon if he's so trained, which I am, or we incorporate an ear, nose, and throat doctor to do the inside, correct the deviated septum, and we fix the outside to get rid of something that may concern the patient. Getting rid of a little bump on the nose, making the tip a little more refined. It doesn't have to look done. It can look very natural. A lot of times, if done properly by the right person, you won't have any idea that something was really done to them. And that's what we really try to achieve. When a patient turns around and goes, "Nobody noticed," that's one of the highest compliments we get. So that's what we try to look for and do.
A lot of times when people think of plastic surgery, you think of Beverly Hills, blonde woman, larger breasts. But that's not what plastic surgery is all about.
It really isn't. Though the reality TV shows have taken a little bit far. The women out there, this one woman who's had 13 surgeries in a day and things like that, that's really not what you want, and you really don't want to do something that's going to make the person look done. We try to really make it look natural. We try to make it so that nobody else really knows something was done, just giving you a refreshed look. And that's really what we try to achieve. People that have the body image issues where everything needs to be done, sometimes there's something underlying that probably should be investigated before proceeding with the surgical procedure, and that's where a good plastic surgeon should be able to sort of weed through that.